What is going on, Insurance Syndicate members? Good morning, good morning, good morning. Hope everybody's doing amazing. Welcome to another episode of our Wow Winning on Wednesday here in the Insurance Syndicate. This call is literally just focused and centered around trying to deliver value-driven content to everybody that's a member here within the group. So again, if you've got anybody that maybe isn't in the group that's within our industry, life, health, Medicare, PNC, whatever it is, please make sure and get them in here so they can take advantage of these calls. And so it's all about winning. And guys, it's Wednesday, right? And I think a lot of us will start to kind of get to that. It's that hump day. Let's keep pushing through, right? So thanks to everybody that tunes in on a weekly basis, whether you're catching it live, whether you're catching it on the replay. Thank you all so much for being here. My name is Joe Kampert, if you guys don't already know. Also, real quick, two things before we kick off. We're going to go through some weekly wins, all that good stuff. Make sure and let StreamYard view your comments. So there's a little, it's like in the description or the caption of the video. And it literally looks like, let's see if I have, actually, I don't have the button here to put it up on the screen. But just let them view your comments, right? Because otherwise it looks like this, which thank you for saying, let's go, Joe, Facebook user. But please let them view that because this is going to be a very interactive call with our special guest that we're bringing on here. We're going to be doing some screen share, some demo, just really showing you guys an extremely impressive tech stack. Okay, so but before we get there, let's do our weekly win. And Tony Merwin, I don't know if you're going to be catching this on the replay or not, brother. Tony's out in Lake Tahoe, so running this one again, and then he should be back next week. So I think he was at the Ritz-Carlton, and you know what's funny is when you send somebody a messenger and you see Merwin was last active 6 hours ago. I'm like, I don't know if he's going to be making this call. But shout out to Tony. Love him. An amazing dude. And definitely check out, he just dropped his Medigap, his next, I think it's his third episode in his Medicare series. And that's for June 21st, I believe. So make sure and check that out in the events tab of the group. So if you got a weekly win, put it in the comments. Would love to highlight y'all. Good morning, Mr. England. How are you, sir? Hope everything's going good. I know you just had those new hires last week, so that's awesome. Thanks for hopping on. My weekly win, you guys know, if you guys have been watching this, you know I've been getting into softball. I think I finally might play for my tournament team. So I play league ball here in Cedar Park, and honestly, I think I've started to kind of figure it out. It's men's slow pitch softball, and you'd think it would be easy. But man, I finally figured out how to hit and had some good plays last night on first. We ended up losing by 1 at the end of the inning, but I decided, hey, I'm at least being like an EH for our tournament team to at least hit for our next tournament. So that is my win. I know there's small wins, right? I guess my other win too is I got to spend the day with my youngest daughter, Nora Jo, yesterday all day. So those are my wins. Again, if you got any wins, feel free to put them in the comments. And while you're doing that, I'll definitely bring them up on the screen. But guys, we have an amazing call that's about to go down. Again, this is it's going to be some of the most value-driven content that we put out here because it's going to be very tangible action items, things that you can literally go and implement into your agency. And what do you know? His name's Joe too. So, you know, us Joes, we got to stick together. But seriously, he has revolutionized how to really operate within the life and health space. Okay, if you're in the life and health space, you're thinking about maybe like PNC, we're starting to kind of branch into that space. What he's about to show you is literally game changer. We're using it here at Redwood. Everybody that we've worked with in the life and health space is using this system. So without further ado, give a nice warm welcome to my good buddy, Mr. Joe Wahl. What's going on, brother?
Thanks for the introduction. I would say our win for the week was getting our Medicare Supplement System up, version 2, which we've spent a few months working on because there's a lot of that.
Are we going to see that at all today?
Yes, I'll run through that.
Woo!
And for those of you who don't know, we operate, as you can see behind me, it's an all-in-one software suite. We do, this time, final expense, simplified term, Medicare Supplement, dental, vision, hearing, and within a few weeks, we'll also have critical illness. We'll be the only quoting platform to have that, and then hospital indemnity. Which a few others have as well. So I'll go right into what I actually have to share. So the system that, let me share my screen first. All right.
And right there, before we pull that up too, I want to go back because obviously, and I've been in literally the software and everything and checked it out, and it's super slick, super sleek. I want to, before we actually go in and look at it, what was it? What was the light bulb in your head that was like, dude, I'm going to make this, right? Or I'm going to be a part of this, or kind of go back a little bit. I want to hear about like the growth stages, or like even where the idea came from. Like, what was it that like, dude, I'm going to create this for insurance agents?
So this was where the idea came from. So I got my license when I was 18. I was a freshman at JMU in Virginia, and I didn't want to work at Staples anymore, which is my office job. So I wanted to, do something where I could work on my own time, but I didn't really know what I was doing. You can see here, this is when I went full time into the field during that summer going into sophomore year. And this is all Gerber guaranteed issue business. I wrote about a little over 6,000 of it in 2 weeks. And
Oh, is this, am I supposed to have your screen up?
Oh, yeah. Do you have my?
There you go.
Yep. So this is a screenshot of my Gerber portal. And about 2 weeks of 2017, I wrote about a little over $6,000 in Gerber guaranteed issue business. For those of you that don't sell life, that means you get paid next to nothing. I was on a 30% as earned contract for all this, and it's a full chargeback within the first 2 years. Or it's like 50% year one, whatever it is. It's not much. So I was barely covering my lead cost.
30% as earned.
Yeah, pretty awful for life. That's pretty terrible. And I was barely covering my lead costs. Luckily, I kind of figured it out over the next few weeks. But as many of you probably know, 99% of agents are out of the business within 5 years. So for every one of me, there's 99 that would have, for whatever reason, not been able to continue. And all of this was avoidable. It was just that I didn't know what carrier to use for the policies I was writing. So that's where it all came from.
Cool, man. Well, good. I love that. And this guy, I mean, you guys can already see, you're about to see why he's on this call, but I think a lot of this industry, and I hope you guys are taking some notes, and this, again, the recording, if you're catching this on the replay, it's going to live in the group, right? So even if you're watching it live, you got to bounce off, you'll be able to reference back to it. I think all it takes in our industry, right, is that one, I always say like the one event is what changed me, right? But it can also be like the one idea, right? The one light bulb that switches to where, again, I mean, what Joe's been able to do in we'll say relatively a short period of time, it has literally changed the life and health industry, right? So I'm going to actually put this in cinema mode, and this should give them a better, full screen there. And then man, just take us on the tour. Again, guys, this is Insurance Toolkits. If you do have questions, if you want to ask Joe anything, you want to ask about what the software is capable of, where to input any type of information, whatever it is, feel free to ask in those comments. I'll get those up on the screen so that we can address those.
Yep. So I know that this is a PNC group, so a lot of you are maybe PNC first, but I can speak to that because I never liked selling life myself. I didn't like the sales aspect. I liked Medicare because people kind of had to have it, which I guess is somewhat of a similar thing for car insurance and home insurance. Most people kind of have to have it, at least for car, you do. So the easiest way to sell for a lot of people who don't otherwise sell life insurance, maybe you prefer it out, to just ask. A lot of times if you ask, you'll find that people have, they have a Colonial Penn policy that you can cut in half. They're paying for a senior life, or they're paying for a Lincoln Heritage. All these things that all you have to do is ask. They already like you. You sold them something else. They trust you. And, I can get you the same thing for 30% less. So that's how I did a lot of my selling, because I was a Medicare first agent, because I hated the sales aspect. So if you are referring your business out, just know it's really that easy. So as long as you can quote and underwrite it, which is what we do, all you really have to do is ask. So the main components of our system is the 4 toolkits we currently offer. So final expense, simplified term, Medicare supplement, and dental vision hearing. So these are all policies that people, a lot of them, under 65 have as well. So it's not just people 65 and up. So for final expense, we'll just run a basic quote here. So without any underwriting information, I'll change it to Texas here. And we'll just do a $15,000 level quote for we'll do a 50-year-old Texas male. So I would say 15,000 is a little bit above. 10,000 is probably the average policy. And then we'll quote it using bank draft. So when I hit get quote here, it'll show me a list of all the carriers available in my state. So when we scroll down, you probably see some names you recognize, like Transamerica, Mutual of Omaha, and we can scroll through the list. The nice thing about our system is that we give you other pieces of information you might not know. So we have the Social Security billing star here, which basically means the carrier will link up the payment schedule if they're on Social Security, which helps to eliminate people overdrafting and things like that. We also have some of the competition in here. So if someone has a Lincoln policy, you can show them, your rate is down here. I can get you something all the way up here. So that's something that's a pretty powerful sales tool for life, that you can show them, how much better of a rate you can get them.
Absolutely.
And the nice thing is it's built as a point of sale tool. So for most life sales, you're doing the bronze, silver, gold quotes. So let's say I want to sell in this case Trinity. I will click compare. I would type in my 3 values. I always did, we'll just do 7,500, 10,000, and 15. Then at this point, I would spin my iPad or Surface, or if I'm on a Zoom, I would share my screen. I would say, okay, Mr. Jones, this is your bronze, silver, gold option. Which one of these works best for you? They would pick your option, and then you just go straight into the e-app. So that makes it pretty simple. And then the main component, obviously, the underwriting aspect. So if I have a client who is taking, we'll do in this case, we'll say they're taking spironolactone, which is a fluid pill or a diuretic. It can be used for a number of different circulatory issues. Most people say they take it for high blood pressure. We'll say it was first filled roughly in 2018. They've been taking it for a number of years. And we'll say they also take furosemide, which is another diuretic. If I can spell it.
Yeah, I'm like, what? I wouldn't be able to spell that.
We're putting in a spell check pretty soon, but they'll ask you the dose. Some of the medications you can tell the use by the dose. We'll say they're taking 60 or less. And you can see here, we'll auto-suggest CHF. So if someone is taking these 2 medications and they tell you high blood pressure, it's possible they only have high blood pressure. It's unlikely, but it's more likely that the carrier will actually see that as a circulatory issue, such as CHF. If you disagree, the client insists they don't have it, you can take it off. But it's those things that, especially if you're not too familiar with life underwriting or even medical underwriting, we can suggest things for you. Another common example is if you put in 3 inhalers for mild asthma, we'll suggest chronic asthma because someone with 3 inhalers doesn't have mild asthma. That's just not true.
Right.
So those are the kind of underwriting things that a lot of people can overlook that are pretty important. Because when I run this quote now, it really changes the results when I have the CHF on there. And you can see we also offer a few other indicators. So if I want to write Security National here, my commission is going to get cut up to 20%. So that might be something relevant for me to know. Maybe in this case, I don't have too much of a better option. You can see there's other commission cuts here. Some of these are guaranteed issue, but here Prosperity does not cut comp. Neither does Transamerica. So maybe on this case, I go with a higher premium, but I get paid the full thing because it is my job. Maybe when I get paid, but I deserve to write the policy. There are other components to underwriting as well. So for life, sometimes things will get referred. So if you're sitting with the client and you have an instant decision application, you don't want to build up the sale the whole time that, hey, we're going to get you your decision today. If it ends up getting referred, it kind of makes you look silly. So in this case, you could tell the client, we're probably going to get you approved graded. However, furosemide, it might kick it to an underwriter. It might take a few days for us to get this decision. Is that okay? So you let them know ahead of time. Then, of course, your prediction is probably going to come true if that's what we're telling you. In addition, all these different plans have different parameters of what they, do and don't cover over the first few years if it's modified. So Transamerica graded is basically a modified. It's return of premium in the first 2 years. Lumico is completely different, and they call theirs a modified. So it's actually closer to a true graded. So whenever you're selling one of these policies, especially one you're not familiar with, you want to make sure you're telling the client the right thing, especially with some carriers like UHL where it can vary based on the state you're in. So we'll tell you what the parameters of the policy are so that you can tell your client the correct thing. The system will also tell you why we're showing the decision we're showing. So if the client is, why am I getting modified? I'm healthy. Well, sir, it's because you have CHF. So it'll tell you the decision in the system, and it helps to kind of prevent some of that combative nature from the client at the point of sale, where you can show them, hey, this is what the system is saying. It's because you've had CHF diagnosed after age 44. It's easy solution graded. There's nothing I can do about that. So it's those kind of things that take away the edge at the point of sale.
So question on, and I'm curious on this, because obviously you didn't just launch this like this out the gate, right? And I think, that's one thing I definitely love really just about technology, man, is that they're, especially and I feel like kind of your situation where you're able to just go in, you got some devs, right? Like you're always upgrading, you're always adding some new features like that, the why part, right? How many of us or like though somebody will tell us something and maybe we trust it, but then we always say, well, why? it's like we're little kids, like when mom told us that we couldn't have candy. Well, why? It's like, well, because I said so. I want to know, like, where did it start, right? To where, like, I guess, how did you find, was it like agent census? Was it like, what was it that was surveys that was like, man, we need to add these question marks. We need to, oh shoot, that one's a commission cut. Is that like personal experience, or like, how did you guys even think about integrating that into the software?
Yeah, so there is a team of 9 of us at this point, so there is a lot of work. It's full time that goes into it every day. However, on YouTube, there's a pretty old video of myself and Dave Duford, who's a life YouTube agency owner. And this was back in the like January of 21, and that was when we launched the system after working on it for a year. And you can see that
Wow.
most of the features I'm going over were in there at the time
Mm.
because those were things that I ran into as an agent. Like I wrote so many times policies where I had no idea that I was about to get a 40% cut with
Right.
Royal Navy's rated. So most of the components were in there, but we've refined a lot of them. We've added more. We've added more products. So everything that you're seeing here is a result of both my experience, and we do take feedback pretty seriously. We have the live chat here. So if you send us a message, we'll send you a response within 15 seconds. There's 4 of us that are on the chat all day, even late at night, weekends. So you can get a response if there's something you're not familiar with, something you have a question about. Maybe the client has a question about, like, what's accidental death? What's the it's not going to be on any of these posts, but
Right.
what does that entail? If you have anything else, you don't have to call an upline. You don't have to work with that. Send a message here, and then we'll get back to you almost instantaneously. So everything actually selling these products. It's not some developer being told by an IMO to build something. It's actual agents. Everything you see here is a data set that I've created, and then the developers.
And you launched this literally so you guys basically it's been like 18 months basically.
We started working on it in December of 2019, and it took us at the time it was just myself and my cousin because he did all the code. We worked on it for a year, and then we launched it officially on the 1st of January of 2021. And since that time, we've added Med Sup, dental engineering, and a lot of other items, mobile support.
Killing it. Killing the game, bro. I love to see that because honestly, dude, I feel like you've taken the industry by storm. Like there's not really anybody I speak with on the life and health side that isn't using insurance toolkits, doesn't like they know who you are, they're using it. I mean, and it's been 18 months, man. So I love that. I mean, that's massive scale, and I'm sure it's only going to get better from here. Yeah, man, that's freaking killer, dude. How old are you?
I am just turned 24.
Just turned 24, dude. And you guys thought I was young. I'm about to turn 28, man. I'm starting to feel a little old. You're getting sore after the freaking softball games. This guy launched this when he was 23 years old, guys. And so again, we'll pause real quick and then we'll get into the other products. And there was a question. I saw your question. I will get back to that, and we'll definitely answer that. But for me, it doesn't matter when, right? Like I think a lot of people and a lot of younger agents, honestly, I feel like they're held back by their age. Like I remember when I used to, and again, I've been PNC heavy most of my life, or most of my career, I should say. Actually, most of my life. I've literally been around PNC since I was born because my dad was with State Farm and yada, yada. You guys know the story. But I think like I would remove my picture from my business card, right? Because I didn't want people to see how young I was. And so I just want to give really kind of a testament to you and kudos to you that at 23, man, nothing was holding you back. Nothing stopped you from taking this to an industry that the average age is over 30 years, freaking like more than you, right? And that's actually, let's talk about that before we get into the other products. Have you had any type of difficulty, kickback, maybe setbacks when it comes to trying to introduce this maybe to an older crowd, right? And I'm talking about agents, right? Because obviously the average age of insurance agent is in the 50s, right? Have you had anything kind of with just trying to get people to really leverage the tech stack?
Yeah, so I believe the average, what I was told, was 62, which seems high to me, but apparently for a life and health agent, that's the average age. And that's
Wow.
where our user base skews because that's where most of the people are.
Yeah.
So instead of, obviously there's a difference between how, I grew up with a computer since I was 2, whereas someone who might have picked it up when they were 50, there's a difference in skill there. So instead of, complaining about that, we put measures in place to help those people. So we have live demos. So when you sign up, you get a link. And if you want to have one of our customer service people go over with you live, or in a small group of 2 to 3 people, how to use it, we do that. We have a number of hundreds of videos on our YouTube channel of how to use things. We have the live chat support. So if you don't know what a face amount is, you can go in the chat, ask the question, and we can help you. If you don't know what a PHI is, for example, which is something that comes up on the term side. So we do have a lot of...
I don't know what that is.
Yeah, so a lot of people don't. So whether it's or just skill, you can ask us questions. You can see the software is pretty unintimidating. I think we designed the UI to be pretty friendly. So if I'm quoting dental and I've never quoted dental before, it's pretty easy to see this is the price, this is the deductible, this is what it covers, and this is how much it'll cover in a given year. So we try to make it very obvious. Things can be moused over, and we'll give you explanations. For SureBridge here, there's a 9-month waiting period, so it's not a true 60, 70, 80. So we try to make it as friendly as possible, bright colors, and it's pretty big.
Yep.
So that's how we've dealt with that.
Good, good. I love it. So let's, we got a question here. You'll be able to answer this pretty quickly here. Do we have to get appointed with all of the companies in your system, or is the system already approved?
Nope. So it's not tied to your license. So a lot of our, for the example I showed on the FX side, we have all these carriers here. You can turn them on or off at your disposal. If you do, a lot of life IMOs do have their own setup with us, whether it's directly through them or a promo code. If you do sign up through an agency, they will have their own carriers excluded. So if they're not contracted with a carrier, you won't be able to see it, obviously. But if you sign up for an individual account, and I'll create a promo code for this group at the end of this, but you can see here where I included Lincoln Heritage. That's not something that any broker is contracted with because they're captive. So even if you're not contracted, you can use it as a way to compare. Maybe you quote a lot in your area and you constantly see Liberty Bankers come up, and maybe that's a carrier you ultimately want to pick up. We don't do that. We're not an IMO, but it can prompt you to pick up something you might not have even have known existed. So,
smart. Yep, that's good.
And same thing with all the toolkits. So anything that's available that we have, and you sign up for an individual account, you'll be able to see what's in the system. So there's no restrictions on that end.
That's good. That's good.
Just so I don't forget it, I'll make a discount code in a few minutes. It'll be Syndicate 15. So Joe, if you want to put that in like the description or something, if anyone wants to sign up, I'm creating that as we speak. You can get 15% off for life without any restrictions on any of our toolkit.
Syndicate, any casing on that, or just all lowercase, or what?
Be all caps, but I don't think it
matters. Okay. Syndicate 15. Cool. All right, and then can you show, because I know you just launched the MedSups, right? So for anybody that's watching this, that is maybe potentially looking at using insurance toolkits, already is, and maybe just weren't aware of the drop, which I'm assuming if you're in insurance toolkits, you probably know that they just implemented this. But maybe if you want, man, just take a few minutes, kind of show us just that new process there, because I think that's going to be big. And I know and it's funny, you say we actually have, I would say probably almost half of our, we've tried really hard, and that's why I have Merwin, that helps me really run the group too, is we've tried really, really hard to keep the group balanced, right? To where I think, for me, again, and this is why it's the whole purpose of the group, right? It's why I'm literally sitting here on a call with Joe Wahl, who has like a system for like final expense and term and MedSups, and it's like, I'm a PNC heavy guy, right? And I think that's just what this industry is becoming. I think, if we really can leverage everybody's strengths, right? Instead of everybody being competition, instead of everybody stepping on toes, I think what's been really cool to see this group do is that everybody's kind of just like come together, regardless of Medicare, regardless of under 65 health, right? Or life or PNC, whatever it is. But yeah, so for anybody that's in that Medicare space, that MedSup space, which I know there's a lot of you that are, definitely make sure and take a look at this.
Yeah, we were actually at the MedSupCon with Tony was there last week. So it is a big space. Especially if you're sitting with clients over 65, I promise you most of them don't understand Medicare. It's very confusing on their end. So it's something that you can help them with if you're just contracted to sell it. So question we get asked before I go into it is, do you support Med Advantage? We don't right now, but I personally really like Medicare.gov. I don't know if any of you have used that before, but I think it's one of the few government websites that they really knocked it out of the park. It's easy to use. You put in the red, white, and blue card, it pulls up all the information. So that's not something we're doing right now, but there is a great free alternative that you can use to quote your Med Advantage. And there's no underwriting with Med Advantage, so there's nothing you have to worry about there. MedSups are underwritten in a similar way to life insurance, and they're quoted a little bit differently. So that's how we have it laid out here. So you just type in your zip code of where the client lives. And in this case, we're looking at Texas. So it has the normal set of plans here. There's a few states, if you live in Wisconsin, Minnesota, or Massachusetts, is a little bit different that we have it in the system. But for most states, it looks like this. And the nice thing with MedSup is that it's very standardized. So if you're looking at a Plan G with one company, it's the same as a Plan G with another company. There are small differences with some carriers, like some will have a gym membership, really small things like the AARP discount card and whatever else. But in general, they're all the same. You can compare them based on price. You do want to be aware of, if you do sell them more frequently, there are a few other components that you might want to keep in mind. We're not going to go over them on the call here, such as like attained age and how the premiums are calculated. But in general, you want to look at the premium that's being quoted each month. So if I've never written a med sup before, and that was the case for one of our partners in the company, Chris, he has sold for the past 6 years over $400,000 of life insurance final expense every year, but he never did he did the occasional Cigna Medicare Advantage policy when it came up. He never even looked at med sup. So when we launched this system, he would just ask the clients, and if they had the med sup, a few weeks ago he ran into one where someone was paying $400 something for their plan F, and he was able to basically cut that in half just by getting them a lower rate. So that's really all it is in most cases. You don't have to viscerally understand it, but if you can at least quote it, you can underwrite it, you understand the basic components. This is the policy fee. This is what you'll be charged if we apply. And in most cases, if it's approved, that's what we'll charge you. If there's a household discount, med sup household discounts are pretty confusing because it can be if they live with someone who has a policy. It varies per state for every carrier. So we'll tell you the rule. For American Financial Security, if you have two people in a house applying that both have an Aetna policy, AFS is an Aetna company, you'll get a discount of 10%. And that discounted rate will be the rate that you see in the expand menu here. We are moving that into a toggle, which will make it a little bit easier, but for now, the household discount is sitting there. So that's really the basics of what you need to know to sell a med sup policy. What's the rate? What letter are you looking at? Is there a household discount? For example, Prosperities is pretty lenient. So as long as they live with someone over the age of 18, you get a 7% discount on your premium, which is pretty cool. So it's just trying to make it unintimidating is how we do it. So I'll give an example with the underwriting here. Rheumatoid arthritis is something that really doesn't matter for life insurance in most cases, but is hugely important for med sup. So a lot of companies have different rules around it. So if I have a client taking methotrexate for RA, the system's going to ask me the milligrams because, like for Move, for example, I believe it's 20 or 25. If they're taking more than that each week, it's going to be declined. But if it's under that, it'll be accepted. However, when you look at the app, it won't tell you that. It'll just say, have you been treated for RA in the past 2 years? If you check yes, it'll indicate decline. But if you know this, it'll actually get approved. Wow. So it's little things that can be the difference of getting a sale, not getting a sale. It really doesn't take any time off of your end. You're just putting in one medication, a condition. And it goes much deeper than that we won't get into this call. But when you're underwriting conditions on the life side, there's a lot of different conditions that go into it. So for diabetes, when was it diagnosed? Do you use insulin? If you do use insulin, how many units do you take? Do you have uncontrolled diabetes? Do you have, there's a number of different questions. So we basically walk you down the chain. So even if you know nothing, you can just put in the health condition and we'll walk you down the questions that you have to ask your client so that you don't miss anything before you submit the app.
That's baller, dude. And that's, I love that you said this. You dropped a little gem for us there. It's the little things, right? I swear I've seen, and again, I know we're younger, right? But like I've been in it for, 8 years, going on 9 years now. And it's like, dude, it's the little things. Like sometimes it's one word that you say that makes you lose the sale, right? And I love that this system comes from a personal experience. It comes from an agent who literally was in the field, and the little things, they accumulate, they add up, right? And I think a lot of people, and my dad says this a lot, I believe his mom is too, it's the little things, man. It's the little things that really add up. And I think we tend to overlook them when it's like, dude, at the end of the day, like I love that you said that though, because it's coming from your personal experience, man. And literally it could be a system. If you don't have this system versus not, where, hey man, it's a shoe-in sale. They want it. They want you to do it, but you don't know how, or you don't know where to go, or whatever it is. And I think this system makes it, 1,000 times easier, especially for newer agents, right?
Yeah, and what we tell people is it's really, you have to look at, what it gives you. Like FFL, for example, they use our system, and they told us that we reduced up to this point in the year the amount of graded guaranteed business that they submit by about 10%. And FFL is on pace to do about $1 billion in life insurance premium this year. So when you do the math on that, that comes out to be tens of millions of dollars in commissions, not to mention the renewals, because the policies are going to stick if they're not GI at a higher rate. So it's a huge amount of business over the bigger picture. But even for just an individual agent, if it's one policy you can get per year, if I can sell one $100 term policy, if you're at 100% contract, that's the difference of, you're looking at $1,000, $1,200 in a year that you otherwise had. So it's the little things like the PHI that I mentioned for this company, this product. If I submit this case, I have to tell the client, hey, we have to do a phone interview after the submission. Maybe they're not comfortable with that, and we submit it with a different company. Maybe they're curious about, especially if you're doing PNC, they probably have term. That's the most common at that age bracket.
Mortgage protection. Yep.
So mortgage protection, it can be very popular. People want benefits while they're alive. If they become terminally ill, critically ill, they have a heart attack, get cancer, have a stroke, many policies will pay out benefits while they're still alive. So that can be, some people buy it just for the living benefits with the face amount aside. Some people want an actual mortgage protection originated from decreasing term. So we have those products in the system. So this product here is a product where you pay for a decreasing term, and then at the end of the term, 10% of that face amount converts into a whole life policy. So if I just sold someone, whatever PNC product, and they're interested in protecting, the mortgage if they pass, they're the primary breadwinner. What's your mortgage amount? Maybe they pay $1,200 a month. Okay, here's a decreasing term policy. If you pass away, it'll pay, your wife $1,122 every month through the end of the term, so that she doesn't have to move out of the house, or you can take a lump sum. This is a little bit more of a complex product, but most of these products are just, what's the face amount I entered, what's the monthly premium, and what's the term length. But we do have some of the more in-depth products here in case that's how you choose to sell. Because for a lot of people, it makes more sense to them that my mortgage is this amount, and this is the amount of the death benefit paid out each month. So it kind of makes it more like a puzzle piece to the client. But like I mentioned, there's a lot of different components. For foresters, they calculate by nearest age. If you accidentally calculate by last age, which 95% of carriers do, you might lose the sale because the client might not trust you if the premium comes back 5% higher when you submit the app. You're about to submit the app and you forgot that they calculated by nearest age. It's those little things with term that can really make a difference, especially if you're PNC, because this is what you're seeing most often is term.
Yeah. So. No, that's good, man. That's good. And then just comment, as a nurse, I love this system because there are so many pitfalls with the applications. So that's even cool, right? Because of hearing perspective of somebody who's on that side of things as well, right? So kudos to y'all. Real quick here, before we kind of start wrapping up, I wanted to ask, so obviously you're 18 months into launching this thing, right? So we'll say, obviously you had a year building it out, and then you're 18 months into actually, being at live, obviously bringing on tons of agents to use the platform. Where is Insurance Toolkits in 5 years, right? Or maybe even like where like what's in the pipeline? Because I know y'all got to have something. Like where do you guys see Insurance Toolkits within the industry? Like, do you ever foresee like getting in at some type of carrier type level, right? Like where maybe you're like actually part of the carrier. I'm not sure. Like, again, I'm still newer on this space, but just where do you guys see yourselves in 5 years?
Yeah, so right now we're working on building out our existing tools. So we have a lot of updates and new carriers for the MedSup tool, which again, we just launched the initial big update or the second big update for that. We want to expand into more toolkits. So like I mentioned, critical illness, which is heart attack, cancer, stroke policies. We're also adding the hospital indemnity in a few weeks. So that'll cover basically all the simplified issue products besides long-term care. We're working on enrollment on the Med Advantage side, which if you work for an IMO that represents Medicare, they're going to give you Sunfire Connection, Medicare Center, whatever it is. So that we're working on that as well at a lower cost point for the IMO. We have a basic CRM built in. We want to build this out a little bit because it's definitely not go high level. It's just a HIPAA compliant way that you can store your client's drug and health information. So if I think I have one from the other day where so this client, so I pushed over, he just had lisinopril. So if I connect with this client maybe 6 months later and he wants to buy a little bit more insurance, or maybe I didn't sell him the first time, I can just push that case back over and pick up where I left off.
Oh, nice.
We're building in an enrollment on the life side as well, which will help right now it just links out to the carriers portal, but we're building the enrollment in to the system itself. So there's a lot of different things on the enrollment that we're working on. And of course, just building out our current tools is always, important too. We don't want to neglect because to this point, we've been really big on the life side, but we're pushing more into health now. That's why we just launched the dental toolkit, and we're working on MedSup and hospital indemnity. So we're hoping to, by the end of this year, be as relevant on the health side as we are on the life side at this point.
That's awesome. That's awesome. We got a question. How does this connect with Go High Level?
So right now we don't integrate directly. We are working on integrations. We do allow you to import the data from the CRM into a CSV. But the main holdup with that is that ours is HIPAA compliant by default, but some of these other CRMs, you have to sign something or they're not HIPAA compliant at all, and that would mess it up on our end. So, for a lot of people, they don't think about that, but you have one leak and you can be charged $10,000. So it's something that's important to us. So as soon as we figure out the HIPAA compliance end, we will have integrations with the CRM.
That's good. That's good. Awesome, man. Well, kind of tell them, hey, where can they touch base with you? Where can they get a hold of you? Obviously, again, guys, Syndicate 15. So if you want to check out the system, not check it out, you should just buy it because it will improve your life and health game. But Joe, if you want, just kind of where can they find you? How can they connect with you? Maybe even if you want to share the website, how they can go through. Looks like you pulled it up here. Yep.
Yep. So we have a 2-week free trial for everyone, so you don't have to pay us today. If you want to just try it out. Again, if you are with an agency, not necessarily on the PNC side, but anywhere else, just make sure to ask your upline, your IMO. Most IMOs on the life side have a discount code or a setup with us that you get it at a discounted rate. If they don't, they just reach out to us. We don't charge the IMO. We can create them a discount code, white label it for them, create the whole setup. But you can find me and our company on Facebook at Insurance Toolkits at my name, Joseph Wahl. You can find us on LinkedIn, Instagram. The only one we don't really use is Twitter, but every other social media you can find us. So.
Awesome, man. Awesome. Well, dude, thank you so much for taking the time. And thank you to everybody that was participating in the call. Again, if you're catching this on the replay, don't hesitate. You can still post questions here in the chat or feel free to message myself or Joe if you want to learn a little bit more. But I think, honestly, there's not too much more to learn. It's more about going and checking that out. Again, that's 2 weeks of testing it before you even actually pay for it, guys, right? So insane value there. Again, if you're an individual agent or your IMO doesn't have it, or if they, for some reason, are not wanting to use it, you got a discount code here through Syndicate 15, okay? And so without further ado, everybody have an amazing week. Oh, make sure and check out our YouTube channel. Go like, subscribe, Insurance Syndicate. Also check us out. We are now on Apple Music. We are on Spotify. And we actually just had a new episode drop today. So every single Wednesday. Love you guys. Appreciate y'all. Have an amazing rest of your week. And hey, it's Wednesday. So let's keep going and get it, baby. Let's finish it out.
Insurance Syndicate, make sure you remember this.